And it happens in the choroid in lattice degeneration of the retina, where the vessels are painted. You can prove it by fluorescein angiography, but they look white to you because they accumulated a lot of extra collagen. Okay, now, let's take this case and go forward. If you were looking at this case, the reason I brought this case forward to you and I showed you a case of narrow angles before, is you would be tempted if you were using our method to say, oh, if I did gonioscopy, the angle's closed. Actually not. This is an artifact that it's bowed forward like this. But if you were looking in doing gonioscopy, there is a scleral spur. But now we have a problem. We have a problem. We have to prove we have an open angle, we have glaucoma, what's going on? So, what do you see inside the anterior chamber here that you didn't see before? What do you see? Rhymes with bells. Cells. And notice that these are not lymphocytes. They're not neutrophils. They're macrophages. And they're filled with eosinophilic material. So eosinophilic material means that it's filled with, give me the P word, yes? Filled with protein? Did you say it, protein? You thought about it. Filled with protein. Where did the protein come from? Any ideas? The lens. So if you said the lens, this is what a wonderful idea. How will the lens protein get from the lens into macrophages in the anterior chamber? Complete the story for me. Is this a good story? Yeah? You had what? Phacolysis. Phacolysis, all right. So, let's go back now in this particular case and look at the lens. And here you can see the lens, and you think, oh, that's a lens. But when you look at the lens, you see, here is the lens capsule. This happens to be the nucleus of the lens. So I could ask you, where is the cortex? And the answer is, it's inside the anterior chamber in the macrophages. Okay? So you have an intact lens capsule. This used to be a hypermature Morgagnian cataract. The lens protein's leaked out. It's in the anterior chamber. And now you have phacolytic glaucoma. It's okay? Yes? No? I can't tell? There's no vote? All right. Let's do another case. There is another condition that will come up in a moment. I am so sorry. I pulled up another case for you. Yes. Let's look at this case. And then I'll get into the cases that you requested. Yeah? You'll notice, please, that there is a gap in the eye here. This is an artifact. And then you have optic atrophy. Okay. Do you notice that this eye is not round? Let me show you something. I can take a line, make a straight line here, another straight line here. This is fairly straight. What is it telling you about the intraocular pressure of this eye? Very low. Because, and what is creating the straightening of the sclera? The muscles are pulling in the case where you have a very low intraocular pressure. I want to show you and prove to you in another way that the intraocular pressure is low even before we see anything else. I'm going to show you some more evidence of a low intraocular pressure because if I look here at the choroid, look, it's not straight. Do you see the bumps in the choroid? These are choroidal folds, which is more evidence that we have a very low intraocular pressure in this eye. Now, there's a lot to say about this eye, but I'm going to focus for you on the lens. And when I focus here on the lens, you can see there isn't very much lens. You can see what is left of the lens. And adjacent to the lens, there are neutrophils. And outside the neutrophils are macrophages. And outside the macrophages, you have fibrous connective tissue. So look at it this way. Lens, neutrophils, macrophages, fibrous connective tissue. Whenever you have a collection of macrophages forms a community, we call it a granuloma. Here you have different zones in the zone, we call it a zonal granuloma. Does anybody have an idea what I just illustrated for you? You have an immune reaction to lens protein. What do you call this? Okay, so Seven said phacoantigenic. It's a very good name for it. I like this name for it. Some people in textbooks will call this phacoanaphylaxis, but it's really not anaphylaxis. The term anaphylaxis got into the textbooks because many years ago in the 1950s, anything that was immune-related was called anaphylaxis. Anaphylaxis, can we put the lights on, Daniel? Is it possible? Let's do this for a second. Somebody told me that here in Afula there is an interest in uveitis. I want to do 1 or 2 cases of uveitis, and I'll try to get to as many of the other cases as I can. Yes? Okay. So let's go through this for just a second. That's okay. So, all right? Yeah. Okay. You all with me for just a second? Okay. We're going to do a little bit of general pathology. This is also good for the residents. Anaphylaxis is basically a mechanism that is mediated by IgE and mast cells. You have the granulation of mast cells, you attract the eosinophils, right? What is the typical ophthalmic example of a type 1 immediate hypersensitivity reaction with eosinophils? What is the classic ophthalmic example of it in the springtime? All right, a vernal conjunctivitis, yes? All right, you got the idea? If you do this long enough, you get keratoconus. Okay. It's probably how I got keratoconus, because I'm very atopic, all right? Very allergic as a child. Type 1 immediate hypersensitivity. What is type 2 reaction? So, cytotoxic reaction, yes. In medical school, we teach a cytotoxic reaction, and we say Coombs hemolytic anemia. Yes? It's a typical way it's taught in medical school. How do you teach this to ophthalmology residents? What is the classic example of this? So, I'm going to have to put this down for just a second, because I'm running out of hands. Every basement membrane produces and rests upon a basement membrane. Okay, you want to hold the mic? No, it's okay. Oh, he's moving the thing. Thank you, Dan. All right. Let me talk to you about this. Epithelial cells relate to one another by means of desmosomes. Like this, yeah, desmosomes. And they relate to the basement membrane by means of, what do you call those? Hemidesmosomes. It's okay? There is a disease in which there is an immune reaction that destabilizes the adhesion of epithelial cells one to the other. Now, under the light, no, it's not OCP. I'm going to come to it. Now, I'm so glad you mentioned that. I'm going to get to OCP in just a second, so stay with me. No, it's a very good thing you brought it up. That's exactly where I'm going. No, it's okay. Yeah, just stay with me. By light microscopy, when people were looking at this, I'm going way, way back before they understood ultrastructure, they used to see that when you put tissue into formalin and you shrink it, you can look in high magnification, maybe 40x, you see little lines that connect the cells. And at one point, those of us who are trained in a certain generation, they talked about intercellular bridges. They're not. It's where the cytoplasm retracts with fixation, and it shows you where the desmosomes are. Please follow with me for a moment. So a Greek word to describe a spine is to say acanth. Acanthocytes are red blood cells that are fragmented, yes? When you have a thickening of that part of an epithelium, I'll try to sneak a little bit of the skin in here for the residents who asked about it, okay? When you have a thickening of the epithelium, it's called acanthosis, okay? What do you think you would call it if the epithelial cells fell apart from one another because of an immune reaction, or even just a virus like herpes simplex or herpes zoster? You call it acantholysis. The disease, one of the major diseases, not the only, one of the major diseases that causes acantholysis, listen carefully, is pemphigus. Pemphigus. Okay. So you answer the question. In pemphigus, a blister is formed. Is the blister intraepithelial or subepithelial? What do you think? If it's acantholysis, it has to be intraepithelial. Fabulous. Wonderful. The reason that people get into, there are many reasons that people get into systemic problems with pemphigus, but they don't get the ophthalmic complications, is because the substantia propria of the conjunctiva is not scarred. The disease is not the immune reaction is not in the subepithelial tissue, it's within the epithelium. So this is a devastating systemic disease.